I'm Sarah. I'll be this man's nurse today. So today we're going to be doing some NG tube placement and removal. So here we go, alright? Knockety knock. What's up? How are you? I'm Sarah. I'll be your nurse today. Can you tell me your name and date of birth? We'll pretend, for the sake of this video, that he did. And we'll check his breast band just to make sure. His name's John Smith. His birthday is 2/21/69, which is very close to my mother's. That's how I'll remember this. And so, first thing we're going to do is we're going to come in, explain the procedure to him. So, listen here, John. Your doctor ordered an NG tube to be placed because, you know, you can't really eat right now because you can't swallow. Is that okay if we do that? Yeah? Cool. Alright, so then we're going to start with some hand hygiene, some privacy, and some overall safety measures. So we've pulled the curtains for the most part. No one's going to see into here. I'm going to move that just for the sake of this video because I don't want it hitting me in the head. We're going to do some good old hand hygiene here. Alright? And this is a clean procedure, not a sterile procedure for some reason. I personally would prefer to do it as a sterile procedure, but I'm not going to for time's sake in this video. So I personally just prefer that because it could slip into the lungs. The lungs are a sterile area of the body. You know, it is what it is. But we'll pretend, okay? So now that my hands are dry, we're going to put our gloves on. It's going to be great. And rip them. Okay. Alright, so we've got our draping here. We're going to move this up over you here, John. Alright. And move it up here so that if anything happens to fall down or he vomits, he doesn't get it all over himself, and more importantly, me. So, then we're going to give him this basin. If he wants, he can hold it there, or he can just hold it in his hand. And then if he has the need to throw up, he can preferably throw up in that. But I guarantee you, this is not going to hold all of his vomit. So, but it'll help. Now, John, we're going to kind of start this whole procedure here, if that's alright. Okay? Cool? Yeah? Gonna make sure he doesn't have any contraindications and check the order on his doctor's order over here on the computer. That doesn't work. But for this video, we're going to say it does. And so, the order says, you know, he needs this NG tube, he can't swallow, all these good things. But not good for him. So, here we go. He doesn't have a broken nose. He's not on blood thinners. If he was, I would not do this procedure because I could poke the inside of him. He could get a nosebleed that never stops and then he could die because I can't stop the bleeding because he's on blood thinners. So, yeah. And if he had a nosebleed or was, you know, traumatized in the face from, you know, a soccer ball hitting him and breaking his nose, I could very highly relate to that with him, and I would not insert an NG tube because it probably would not go in. So here we go. We're gonna take this good old boy out. We're gonna drop that and not use it because now it's not clean. So we're gonna use one of these other ones that's over here that we're gonna pretend we got from a clean area, okay? And we just opened from the package. So, here we go. We got this little cup of water here that I'll explain when we get to it, alright? So, we're going to dip this in some good old lube. Lube her up real good, because you do not want to go in dry with this, because it's going to hurt. You don't want to go in dry with anything. Alright. So, lube that all up, get it in there, come up to John, be like, hey buddy, we're going to pull your head back here, okay? Is that okay? We're going to look at his nares. Usually the right nare is bigger. For the sake of this video, I'm going to say his left nare is bigger because he's an oddball, alright? So, now, before we do anything, we're going to coil this up a little bit. Make it a little more pliable, you know. Make it a little easier to go in for him. So then we have this nice little curve here. We're going to point that down because we don't want it going up into his brain. It won't really go up into his brain, but you know. It might. So, we're going to aim it toward the nasal floor, into his nasal cavity, eventually into the nasopharynx, John, and then it's going to go into your esophagus, gonna go into your stomach and it's gonna help you nourish yourself. You got that? Great. So, can I start? Yeah? Alright, cool. So we're gonna take this, like I said, insert it this way. Here we go. Alright, big deep breath for me, buddy. Ready? Okay, relax. Here we go. You're gonna feel a little resistance up in here because of the nasopharynx. That's perfectly normal. Use a little bit of pressure to get it through. If it's really stuck in there and you cannot get it through there, don't force it, please. Because that could mean that there's something blocking there. There could be a break you can't see. He could have, you know, a huge booger stuck in there that you're going to dislodge. I don't know, but don't do it. Don't force it. You never force it. It's all about consent. So, here we go. And then we're going to put it back a little further. We're doing good. He coughs right now, right? Okay? Starts kind of coughing, you know, normal. So, we're going to release his head. Let him sit down a little bit. We're going to actually put his head down toward his chest. And then we're going to ask him, here, to take a good old drink of water. And then we're going to ask him to swallow. And every time he swallows, we're going to move this NG tube down. So I'm not going to hold the water because I don't have that many hands. Ordinarily, I would have someone help me with this, all right? But I'm a lefty, and I'm on this side. So he's going to swallow. I go in a couple inches, swallow again, couple more inches, swallow again, couple more inches, until we get to about the 48 mark, which I measured. I did not measure it during this video, but I swear I measured it. I promise. And the way you would measure it is from the nostril to the earlobe, and then you would hold that piece on the earlobe and then measure to the xiphoid process. Okay? I like to usually go a couple centimeters after that because if you just go to the xiphoid process, I feel like it doesn't actually get into the stomach. So if we go a couple centimeters after, it's pretty much guaranteed that you're going to get stomach contents, alright? So we're at 49 here, centimeters. And so he's feeling good. We're going to check for placement, right? We're going to take this little handy dandy flashlight here and we're going to look in his mouth. Make sure it's not coiled up in his mouth because that's a bad thing. Because then it hasn't gone anywhere. And it's not going to do its job because he can't swallow and now you're choking him with a tube. Okay? Also, we want to make sure that it's not in his lungs. So, we're going to take this handy dandy little syringe. Bring this over here. You see this blue tube? You never want to put anything in this blue tube. Okay? That's bad. Blue tube, you don't want to go there. If you do put something in the blue tube, you're wrong. So, you're going to put that in there. Not the blue tube, because the blue tube makes sure that it doesn't stick to his stomach while it's in there. And we're going to aspirate a little bit of stomach contents out. All that means is we're going to pull it out a little bit. We're going to get some aspiration. We're going to look at it, make sure it's a little yellow, green, brownish. Looks like kind of like what you look like when you throw up. You know? If you've ever thrown up, which most of us have, you know what throw up looks like. You know what stomach acid looks like. It's gross. And then, just for good measure, we're going to take it out. Put it on a little bit of this pH test strip here. Alright? And we'll just pretend those are just scrap pieces of paper, but trust me, they're pH test strips. And we'll look, make sure that the pH is pretty low, like a 5.5, somewhere in there. You do not want it to be normal. If it is a normal pH that is balanced 7, you know, that's great anywhere else in the body, not this. If it's that right now, it's in his lungs and you need to take that out. Also, if he's coughing, his O2 sat is super low, he can't breathe, he can't talk to you, immediately please take it out because he can't breathe. It's in his lungs. It's very serious. Okay, cool. Alright, so now, all that lovely stomach acid we were talking about earlier, I'm kidding. Okay, I swear. So, all that lovely stomach content we were talking about earlier, I'm just going to push that back in there. Okay? And then the third and final way that we're going to check for placement, the gold standard of checking for placement, is an X-ray. Because you can see physically where that tube is. You can check from a side particularly. Because if it's in your lungs, you're going to see it in the lungs. You're going to see it in that trach. If it's in the stomach, you're going to see it flowing down that esophagus, right into the stomach, just where you want it. Alright? So, we've done that. We're going to clamp it back up. This is called clamping. You don't want to put like clamp on like you would put a clamp on an IV, alright? Because that's wrong. Because then the suction, well, not the suction, but you know, the reverse pressure basically that this little tube makes, make it so this doesn't suck on your stomach constantly, on the wall of it, oh, that's not going to work. So then it's going to be sucking on the side of your stomach. It's kind of going to be like when you put a vacuum on your skin when you're a kid, but constantly, and inside your body. It's not going to feel great. So, we've checked for placement. We're going to use our handy dandy little handmade nose strip here because we ran out of actual ones and we're nurses. So we have to be thrifty with what we have because the hospitals can't afford actual supplies, alright? So, here we go. Put it on his nose. Wrap it around here. It's not working quite as well as we would like, but it's going to work. He's an elephant now, alright? So, still breathe. His nostrils aren't, you know, obstructed. He can still breathe out his mouth. Don't worry about that. As long as it's not in his lungs, he'll be alright. I swear. So, now let's say, you know, you need to feed this guy. How are you going to feed him? I'll tell you. So you're going to unclamp it, once again. You're going to stick your little syringe back in there. But first, because you don't want to do this with it in there, unless you're doing residuals. You want to make sure to pull that out. If you are doing residuals, you want to stick it right on in there. You're going to pull out as much fluid as you can. Residual just means whatever is left in the stomach. So you're going to pull out as much as you can. You're going to dump her all right back in that cup. You're going to do that over and over again until you get nothing back. So then, once you get nothing back, you're going to measure it out of that cup. If it's like as much as you put in the last feeding, that means he's not digesting, and you probably should not feed him. Okay? So, then to put that all back in, this is the same way you're going to feed him. Stick that there since that's a clean area. You're going to have this. It's called a gravity feed. We're not going to push this because if you just shove it all in his stomach at once, he's probably going to get some cramps and it's not going to be pretty. So we're going to pour it all back in there, make a little gravity feed. You know, the higher you hold it, the faster it's going to go. So then we got all that back in there, push it in. But wait, we need water. Because you never want to end with just feeding them. You want to end with flushing the tubing, because otherwise that stomach acid and all that nasty bile and crap in there is gonna end up eroding the tube. So, you want to take some good old water or some saline, either way. It's going in the stomach, so it's not a sterile environment. You gotta pour that in there, right? Flush the tubing, make sure it's all nice and clear. Put that bad boy back in there. Unplug it, because you don't want to inject air into the stomach, because then they're going to burp a lot and they're not going to be comfortable. And then, finally, we're going to clamp that back up. Make sense? Cool. So then, finally, if we need to give them medication, it's very similar to feeding them. So let's say we have some of these pills here. You see little pills in there? Cool. So if it's a capsule, make sure it's okay. Make sure it's okay no matter what medication it is that you're doing this. That you can combine it with water.
14 minutes.
Okay. Okay. And then, basically, you're going to combine that with water, stick it in like you're going to feed it, and between each medication, you're going to put water in. Simple enough. Same thing. If you were going to suction from this, even though that's not my skill, you're going to put a little connector in here, like that. You're going to reach over to the suction machine, connector there, you're good. So then let's say I leave, come back, you know, whatever. I'm going to come back in, identify him, hand hygiene, all that good stuff, once again. Standard procedures. So, doctor ordered now to have this removed. And look at that. This is already taken off. So, we're going to remove it now. We're gonna make sure that John over here is nice and comfortable. We're gonna get some good old gauze out for when we take it out. Okay, very small gauze, but we'll pretend it's gonna work. You also might want to hand them some tissues if they're gonna cry. You know, it happens. You're irritating the nose. You'd cry too. So, you're gonna put it there. Tell them to take a nice deep breath, alright? And then they're going to hold it. And when you tell them to hold it, you're gonna pull it out nice and smoothly. Okay? Then you're gonna wipe their nose, clean up in their nose a little bit with a Q-tip or something if they need it, give them tissues to blow their nose. They're probably gonna want a drink, so you know, give them their water back, all that good stuff. And you've noticed that they've been in a high Fowler's position this entire time? Yeah, that's because they need to be. Because otherwise, if they're laying straight down, they could aspirate and die. So, that's how to insert an NG tube. After this, we're going to make sure our patient is nice and comfortable. Alright? I'm going to leave him here. Make sure he's got pillows. We can raise his bed back down if he wants. Take all these lovely things away. And we're going to throw this away. I'm just holding this because I reuse it to practice with. Cool? Okay, thanks for watching.